To begin, let's look at some of the materials involved with bioceramic technology. They are zirconia and alumina, calcium silicates, calcium phosphates, hydroxyapatite, bioactive glasses, and even radiotherapy glasses. Bioceramics have been used extensively in orthopedic medicine, and some of the more common applications are for joint replacement, the improved biocompatibility of metal implants, and even acting as a framework for tissue replacement. Even more important than some of the applications are the properties associated with bioceramics and endosequence BC sealer. Some of these key properties are that BC sealer comes pre-mixed in an easy-to-use syringe, that it is strongly antibacterial with a pH of 12.8 in the initial 48 hours, that it is non-toxic and it is extremely biocompatible, that it does not shrink upon setting, it is osteogenic, it is highly radiopaque, and it forms hydroxyapatite as a result of its hydration reaction. And it is this hydroxyapatite which allows it to bond to the canal walls. And when used in conjunction with the new bioceramic coated cones, it will bond to the BC gutta percha as well. The key to hydraulic condensation begins with the endosequence file and its constant taper preparation. The result is that we can now have laser-verified paper points and gutta percha that precisely match the preparation. Even a prefabricated post can match the constant taper preparation. This is known as creating endodontic synchronicity, and it is very significant. We also now have available bioceramic coated gutta percha cones, which allow us to generate a bond between the bioceramic sealer and the gutta percha itself. As previously mentioned, the BC sealer, as well through its properties of hydrophilicity and its ability to create hydroxyapatite, also creates a chemical bond to the canal walls. The technique itself is quite straightforward. After completing the preparation and confirming the master cone fit, simply take the BC syringe and slowly inject the sealer into the coronal 1/3 of the canal. You can see how beautifully this technique fills the webs and the fins. This technique works equally well for sealer-coated and non-coated gutta percha. The following are micro CT scans performed by Dr. Adam Lloyd at the University of Tennessee. Please notice how the sealer goes into all the webs, fins, and anastomoses in a natural tooth, just like it did in the block. These scans are quite beautiful, and they really showcase the properties of this wonderful material, endosequence BC sealer. BC Sealer is hydrophilic and with a small particle size of less than 2 microns features a low contact angle. Properties which allow it to spread easily over the canal walls and to fill webs, fins, and lateral canals. The following case by Dr. Alan Ali Nassay of Boston shows a resection of an extracted tooth. As Dr. Nassay grinds the tooth towards the coronal area, please note how the BC Sealer has completely filled the entire C-shaped canal. This is very significant and a wonderful demonstration of the material and the technique. In review, the technique is as follows. Confirm the master cone fit. Slowly inject the sealer into the coronal 1/3. Coat the master cone if you wish, and slowly insert the cone to the working length. Burn off the cone at the orifice and lightly condense. The following is a difficult clinical case. A 4-canal maxillary second molar. Here we see Dr. Nassay inject the BC Sealer into multiple canals. In fact, you can see it go down one mesial canal and come up through the adjoining MB2 canal. This is a great case and an excellent example of synchronized hydraulic condensation. The following are clinical cases that were completed using Bioceramic technology, and specifically EndoSequence BC Sealer. This first case is an example demonstrating how synchronized hydraulic condensation will allow you to maintain the original canal shape. Case number 2 is a maxillary premolar that has 2 canals merging together. Notice how beautifully this technique allows you to accomplish complete obturation of the root canal space without destroying the canal anatomy. In our third case, synchronized hydraulic condensation allows us to obtain results that we could have only dreamed about a few years ago. In case number 4, we have a difficult retreatment of a premolar underneath a bridge, which clearly shows how a tooth conservative technique, such as hydraulic condensation, gives us the ability to accomplish retreatment in a very effective and conservative manner. Case number 5 is very important. A key feature of BC Sealer is that it does not shrink or resorb upon setting. In this case, we see a large lesion and an overfill on the post-operative x-ray. Yet 5 months later, we see excellent healing, well underway, and the sealer has not resorbed. Furthermore, because it is in essence a bone cement, it has excellent biocompatibility. Therefore, a reasonable size overfill will not compromise healing. Let advanced material science work for you in your practice. more information, please contact Brasler USA or Real World Endo.